Hello, everyone. It's a pleasure to be here today with you, and hopefully you'll have an enjoyable couple of hours. Today we'll be talking about radiofrequency and radiofrequency microneedling. It's a popular technology, but we are waiting for a couple of doctors to arrive in a few minutes. So as a warm up, I need to know who is using Dermapen or Dermaroll in their practice. Everyone. It's a beautiful technology. It is under-marketed, but I think it is one of the most wonderful technologies in hand. I really adore it. And who is using microneedling radiofrequency? So again, everyone. Again, this is, I think, in the last 10 years, this is the most significant technology in the market because it does a great job. The results are reproducible. It doesn't fail. And it's associated with no or minimal downtime. And this is what everyone wants. And its effect is really progressive. So after we finish what we do, whether it's 1 or 2 or 3 sessions, the skin continues to improve for 6 months. And then there is possibility for maintenance because aging is a dynamic process. So rejuvenation also has to be dynamic. So it's some sort of a continuous relationship with this patient or customer. They will need to come in order to do maintenance procedures. So it's really very, very nice. And who is using radiofrequency? A little bit less popular, yeah, which makes sense. We'll talk today about the radiofrequency as well quickly, and we'll see the concepts of combining treatments in order to improve all the layers of the skin. It is really one of the most common mistakes we do as practitioners is to have telescopic vision. Someone coming to complain of melasma, so we treat the skin pigmentation. We forget that this pigmentation is present in the skin, and the skin is undergoing a process of aging, where we have an impact on the skin structure and function. So it's not only the pigmentation, but other aspects the patient is not aware of. The pigmentation of melasma is never going to be cured. So it's once melasma, always melasma. So if we focus on the melasma alone, we are going to fail. However, if we improve how the skin is looking in general, with the collagen loss, with the epidermal barrier dysfunction, and with the pigmentation, then the patient is going to be satisfied, even if we didn't succeed 100% in treating melasma. So it's a concept where we need to target rejuvenation, not to fix the problem the patient came with, because then the outcome is not going to be optimal. So today we are going to explore those issues, and I hope I can continue till the end of the session because I just arrived from Toronto last night and I have jet lag, so I didn't sleep the whole night. So hopefully I'm not going to sleep while I'm talking. So please wake me up if you find that I'm sleeping. I need this session to be interactive. So at any moment, if you feel that there's a question, something not clear, something you don't agree with, please stop me, let us discuss so that you keep me awake, and also to discuss everything, by timely manner. Anyone is having Endymed? Excellent. Okay. Can you tell us your experience with how long have you had it? 5, 6 years. Excellent. So you're an expert. You should come and talk to this. Actually, I'm working with it in Canada for also maybe 10 years or so. What is the most popular indications you are using it for?
I have more patients from our skin tightening.
Skin tightening. Excellent. Perfect. Do you use it for body as well or only face?
It's semi-light, but generally mainly for face.
Okay, perfect. For the body, are you using it by itself or you have combination of different technologies? Yeah, for the body, I think it's a bit complicated because we have multifactorial pathology. So one technology will never be enough. Always we have to do something in order to improve the microcirculation and the lymphatic drainage. We need to do something for lipolysis. We need to do something for tightening, and then we need to do something for the sclerosed connective tissue. So it's a bit complicated, and that's why combination of technology is very important. And I strongly believe that combination treatment is really required in everything. So this is very good. For the microneedling radio frequency, what are the most common indications you are using it for? Acne scars, stretch marks, pores. Excellent. Very good. Okay. What about you? You are using also the Endymed? For tightening as well. Excellent. Anyone who is using RF, did you see that some cases or some patients who are having laxity, they don't respond well to the RF? Did you experience something like that or no? Not at all. No? With the radio frequency, this is a technology which works through creating impedance. It's an electrical current with high frequency. So when it goes into the tissue, there will be resistance or impedance. And this impedance is going to be maximum in the water. So the water containing tissue are the most resistant for the electricity, and this is where we are creating more heat. And that's why the RF technology is going to be very good in tightening, because the heat is going to be deposited in the subcutaneous tissue where there is fat, because fat contains most water. So if we are working with the RF in order to achieve tightening for someone who is having enough subcutaneous fat, this is going to be perfect. And the results are going to be really very good. However, if you are working with the RF on someone who is slim but have skin laxity, the results are going to be very weak because there is no enough subcutaneous fat. So we have to be a little bit selective when we are selecting the patient for certain technology. And this is really very important in order to make sure that we are getting result in every single patient we have. Patient selection. This is very important. When we are working on the microneedling, this is completely different concept because the dermis is having water, significant water to react with the radio frequency. So we are able to get results in every single patient. In my experience, the microneedling radio frequency is much more reproducible than the RF, because with the RF, we have patients who are not going to respond well if they don't have enough subcutaneous fat. However, with the microneedling radio frequency, every single patient we treat, they are going to see results. Now, having said that, it's really very important to deal with the patient expectations, because this is a place where we fail sometimes. If the patients are having very high expectations and they don't get it, they are going to be frustrated. So in the initial consultation session, it is really very important to spend enough time with the patient explaining what to expect, how soon we are going to see results. Of course, sometimes, I mean, the human body is not like machines. So the reaction might be different from one patient to another, from one body part to another. Even in the same patient and the same body part might react today a little bit different than next month when they come. So it is really very important to explain that to the patients. And we have to know that whenever we do something with any technology with the objective of stimulating collagen, new collagen synthesis is going to happen within 3 weeks. But this newly deposited collagen is immature collagen. It's not functional. It needs to mature. And this is a process which takes 6 to 8 months. So we tell the patient that we are going to do the procedure today. Usually the protocol is 3 sessions, 1 month apart. And then we tell the patient that expect improvement of the skin slowly but surely over 6 months. And then we start to do the maintenance, which can happen every 4 to 6 months, which means 2 to 3 sessions per year. But we have to remember that this technology is targeting the dermis to stimulate the collagen and tighten the upper layers of the skin. And this is not enough by itself, as we are going to see in the presentation. We need to have a comprehensive rejuvenation plan in order to achieve rejuvenation. So this is really very important in order to get the optimum outcome. But it's important to let the patient know that it's slowly but surely. And because of that, documentation is very important. So in my practice, sometimes patients come to tell me, I didn't see any results. So I tell them, I did see you for 1 or 2 or 3 months, so I can see that there is a difference. They say, no one is commenting, no one is telling me that I look better. I tell her, okay, let us look at the photos. When she looks at the photo, she opens her mouth. Several times, I had situations like that. And after seeing the photo, she sends her family and friends. So when the improvement is happening gradually, it is just like our kids, whom we don't observe that they are growing because we are seeing them every day. If someone came and saw them after a year or two, they'll say, MashaAllah, they became much taller. We don't observe that because we see them every day. So the same happens. Any improvement or worsening of the skin, which happens gradually, it's not that easy to observe. And that's why documentation is very important. So I think those are some important practical tips which I wanted to share with you before we start the presentation. Can we start or we need to wait a little bit more? Any comments or questions before we start?
During my journey of microneedling radiofrequency, one patient,
Yes.
I don't know why.
The question is that during her usage of the microneedling frequency, she had only one patient who had hyperpigmentation. Did you come today driving? Okay, so you can drive your car and go wherever you want and do whatever you need to do. And someone else can drive a car and make an accident, kill someone. So it is really dependent on which technology you are using, how you are using it, what skin reaction happened, and how the skin was taken care of after. So there are some technical details during the procedure which are really very important to keep in mind, which we are going to be talking about in the practical session. And if complications happened, then we need to take good care of that so that it doesn't turn into hyperpigmentation. And of course, selection of the machine is important. Some of the radiofrequency, microneedling radiofrequency devices are extremely painful because the technology they are using, they have a spring which where the needle is shot into the skin, and this is very painful. This device, for example, is having a motor which is going very slowly and gradually to the skin, so the pain is much less than other technologies and other devices. This is one thing. The other thing, the wave of the radio frequency. This device is made in a way where, while the needle is being inserted into the skin, there is no radio frequency. And then when the needle is inside, the radio frequency is emitted, and then it stops so that when the needle is getting out of the skin, there is no radio frequency. With that wave of the radio frequency generation, the surface of the skin is not exposed to radio frequency neither when the skin is going in, when the needle is going in, or when it is coming out. While we are working, some people are very eager to have fast devices. This is not good because with fast insertion and getting the needle out, it is very possible that you will remove the handpiece, the tip, from one spot to another while the needle is still out. And this is not good because then the radio frequency is going to be emitted where it shouldn't be emitted. And then this is going to cause microcrusts, and this can turn into hyperpigmentation. The other common problem is that we apply numbing cream on the skin before we start. So if we don't remove it well, the traces of the cream or any wet fluid on the surface of the skin might cause spark, because radio frequency will interact with water or with fluid and can cause minute burn on the surface of the skin. So it's very important to make sure that we remove any traces of the anesthetic cream or any skincare product from the surface of the skin. Otherwise, we have a higher incidence of microburns and microcrusts, which can turn into hyperpigmentation later on. So those are the most popular two causes of microcrust, which shouldn't happen if we do the right thing. Hassan, should we start?
Yes, yes, please. There are many doctors coming on the way because of the location. It's not in Google, but
Yeah.
they are coming on the 5 minutes.
Okay, perfect. So we can start. Sorry?
There is a pointer.
A pointer? Okay. Thank you. This is okay, perfect. So my name is Ashraf.Badawi. I'm a dermatologist, originated from Egypt, but I'm living in Canada for the past 10 years. I'm a professor of dermatology in Cairo University, Egypt, and also a visiting professor in Szeged University in Hungary. And currently I'm the president of the European Society for Lasers and Energy-Based Devices, and also the president of the European Society for Cosmetic and Aesthetic Dermatology. And I'm really happy to see all of you. Some I haven't seen for a long time because of the COVID. So it's a pleasure to be here physically, finally. So today we are living in a world where everyone is very much aware of the appearance. A few years ago, we're not caring much about the appearance of our face and our skin. But today there is strong pressure from the media, from the society, plus the tools available are making everyone very eager to not to show any signs of aging, or if there are signs of aging, to revert it back. There are so many options, and social media is full of advertisements and so on. So now everyone is very much eager to keep the skin in the best shape possible. And this is a big demand in our fields. There are so many technologies in the market today, and all of them are working on the skin to improve the appearance of the skin. And sometimes it's really confusing. Which technology should I get? And the funny thing is that 80% of the technologies in the market, they're not based on true science. They are based on marketing. And this is a big hassle, because at the end, it is our reputation. When we buy a technology based on marketing, and then we start to offer what the company told us, and then the patient comes back because they didn't get what they expect, it is really affecting our reputation. And at a certain point, patients started to say that dermatologists are after our money, and they become more conservative. So it is really our job to understand well the science behind any technology and not to be driven by marketing. A couple of months ago, I was in Monaco for the World Congress of Anti-Aging. And the exhibition was one of the most crowded exhibitions I have seen in my life. It was just after the corona, and it was exploding. Everyone was very much eager to go physically. 6,000 people attended the conference, but the exhibition was really full. And the amazing thing is that I saw so many technologies which disappeared. It was in the market a few years ago, and it disappeared because it was not performing well and so on. Now it is again in the market with new names, the same technology, the same device, but with new name, so that people forget and start to do the marketing again. So it is really very important to understand any technology, what is the scientific base of it, how can we do the best job with that technology, and how to use it and how to select the patient for it. This is our job. It is not, don't get your information from the company. We are the dermatologists, we are the doctors who can decide what is good for what. So why do we need another aesthetic technology if we have so many technologies in the market? Because sometimes we are left with challenging cases, dark skin, where lasers are not safe, and many technologies, IPL is not safe, and many technologies are either unsafe or not effective. So we have to find something which works on all skin types and safe. Again, sometimes we have challenging cases like acne scars and dark skin, and if we use lasers, then we are going to be left with hyperpigmentation. If you are aggressive, then there will be scarring. IPL doesn't work on that kind of skin, and so on. Large pores, a big problem, and in many cases, we are not really successful in improving large pores. Again, large pores, especially in Asian skin is very much prone for hyperpigmentation, and if we try to treat that with something which has significant heat, like fractional lasers, then we are going to be left with hyperpigmentation. Combined technology, skin laxity, large pores, acne scars, active acne. those are issues and problems. And in many cases, the patients are not having satisfactory results, either because it takes long time and long sessions, or because we are not doing the right combination and then we are not getting the optimum results. Stretch marks, it's a big challenge. And in many cases, in these areas of the world, when we try to treat stretch marks, we are going to be left with hyperpigmentation because we are treating patients who are prone to get PIH. So it is a big challenge. Some technologies are very effective, like resurfacing. However, the downtime is significant. And today, the social downtime is something no one accepts. In many cases, I have patients who are telling me, I don't want my husband to know that I'm doing something. So even non-ablative fractional lasers, where only 2 or 3 days of downtime are not acceptable. And this is happening very frequently in our lives. Sometimes we have photo damage in very skin, but in order to get that result, we need either very aggressive treatment like resurfacing, or it takes long time in order to achieve that result. So patients are not very happy about that. So the key clinical demands are, we need a technology which is colorblind, so it is safe on all skin types, because we are living in an area where we have all population from all over the world living here. We need something with proven clinical effectiveness. I don't want patients to come and say, we are not happy with the results, we didn't see results. Minimal downtime is very important, and consistent results. Ideally, it's very important to see that the results are reproducible. Otherwise, patients are not happy and they might ask for their money back and complain and so on. And this is something we can definitely achieve with the right technology, with RF fractional skin resurfacing and RF microneedling. My belief and my practice is to restore aesthetic skin health. And this is, I think, the foundation. When we are injecting someone with fillers and botox, is this considered rejuvenation? Is this considered rejuvenation? What is the definition of rejuvenation? Let us agree. What rejuvenation means? What does it mean? Is it improving the appearance of the skin? Improving the appearance of the skin is not rejuvenation. When I'm using Botox, I'm relieving dynamic wrinkles and lines. But did I improve the structure and the function of the skin? If I'm injecting fillers in order to boost lost volume, is this rejuvenation? Is it improving the structure and the function of the skin? Maybe partially. Some of the fillers are going to stimulate collagen, but most of them are temporary filling. And by the time the Botox or the filler is gone, after a year, after whatever, the patient aged that much. So the end point is worse than the beginning, because there is a process of aging. So by the time the filler is gone, the skin condition is 1 year older. So our objective should be rejuvenation, which is restoration of the structure and the function of the skin. So whenever you are offering any aesthetic treatment, you have to think, is this rejuvenation? Am I improving the structure and the function of the skin, or this is just a temporary fix? Sometimes we are obliged to do temporary fix. The patient is having an occasion, they want fast results, so we cannot depend on something which is going to take weeks or months to happen. But we have to understand, we have to let the patient understand what is the best of them. And in my practice and in my belief, we always have to restore the aesthetic skin health by working on all barriers of the skin to achieve rejuvenation, restoration of the structure and the function of the skin. There are 4 key elements. We need to achieve healthy epidermis with intact barrier function. This is crucial and very important in every single patient you are seeing, regardless what they came for, whether they are coming for Botox or fillers or acne scars or large pores or melasma. We need to have epidermal barrier function. Why? Because if we have healthy epidermal barrier function, then the hydration of the skin is better. When the hydration of the skin is better, then the elasticity is better, so the skin is smoother, the pores are going to shrink, and the fine lines will go away. When we have healthy epidermal barrier function, then the absorption of anything we apply on the skin is going to be much better. So it is really very important for everything. We need to eliminate the photo aging, which is happening to every single one of us. We need to have ongoing collagen regeneration because we lose collagen every day, starting from the age of 20. And we need to improve the foundation and volume loss. Those are 4 things we need to achieve whenever we are encountered with skin aging. This was a study I published in Laser and Surgery and Medicine with some colleagues in 2011, 10 years ago. This was about non-ablative scar treatment in dark skin using the sub-millisecond NDA, non-ablative laser rejuvenation in combination with microdermabrasion. So we were using at that time microdermabrasion to improve the epidermis and the non-ablative NDA in order to stimulate collagen and achieve some tightening in the dermis. And actually, they did the journal. This is one of the most prestigious journals in laser applications. They did put our photos on the cover page. Why is that? Because we used the laser, non-ablative NDL, with no downtime, with 0 complication, in order to achieve results like this in 3 months. So this was 3 sessions of laser, 1 month apart, a non-ablative laser, and this was associated with no downtime. So that was impressive. The non-ablative rejuvenation had a peak and then it disappeared till we started to use the NDA again this way in order to stimulate the collagen. At that time, the microneedling was not there, but even if it was there, I would still today use this technique along with microneedling radiofrequency in order to improve further the acne scars better than this. So tonight, we are going to talk about the radiofrequency, the fractional skin resurfacing, and the RF microneedling. I'm going to focus on RF and RF microneedling. What are we treating and why? Mechanism of action, theoretical and practical considerations, and clinical applications. The objectives of rejuvenation should start with improving the epidermis. Usually, the photo-damaged skin is going to be having this epidermis, where we have hyperkeratosis and much less living cells. And when we have a structure like that of the epidermis, this patient is not coming to tell you, I have hyperkeratosis. They don't know what hyperkeratosis means. They will tell you, my skin is not looking well. مفيش نضارة في بشرتي, right? So why is that? Because we have less number of living cells which are responsible for the nutrition and the metabolism. Those patients are coming to tell you, my skin is dry. I never used to have dry skin, but now I have dry skin. Why is that? Because when we have hyperkeratosis, then the skin is like that. We have cracks and gaps in between the cells, which are allowing transepidermal water loss. So the skin is vaporizing the water. So the skin becomes dry. And the problem is that when we have dry skin, we lose the elasticity. You know this. I use this a lot. This is a baby who's having gastroenteritis, vomiting and diarrhea. They lose fluids. And we teach the parents that every now and then you have to pinch the abdominal skin. If it does not retract, this is a sign of dehydration. You have to rush to the hospital. This baby needs intravenous fluids. And I'm just putting that because this shows you the impact of the dehydration on the skin elasticity. Sometimes we perform that test where we pinch the skin in the dorsum of the hand. If it retracts slowly, then this is a sign of dehydration. So when we have this structure of the epidermis, maybe you are going to pull the skin and then it's going to retract. So we think nothing wrong is wrong. However, when we have this on the microscopic level and there is transepidermal water loss, the skin elasticity is definitely impaired. And when that happens, the patient will come to complain of 3 things. Number 1, I lost my skin smoothness. The smoothness is not there anymore. Number 2, I have large pores. Number 3, I have fine lines and wrinkles. All those are happening from this. Whenever we have someone who's having large pores or fine lines and wrinkles, we jump into the dermis. We want to stimulate collagen. Whatever collagen stimulation you are going to be doing, while you have defective epidermis, it is not going to improve enough. So when we are doing something in order to fix this structure and convert this epidermis into that one, then the transepidermal root loss is going to be much less. And in this case, in this scenario, the skin is going to be much smoother because it's well hydrated, the elasticity improved, and the pores are going to shrink, they are going to be, and the fine lines will disappear. Before we do something at the level of the dermis, which we'll do, but it's very important to improve the epidermis first so that whatever we do under the surface of the skin is going to be reflected on the skin much better. So in many cases, patients are coming to complain of things beyond the surface of the skin, like acne scars, like large pores. But if we examine the skin well, we are going to realize that the epidermis is impaired and we need to do something to improve the epidermis. This is, in my practice, a must for every single patient, regardless why they came for. So this is the epidermis. Then the dermis is having changes which happen with aging, and also the subcutaneous fat and tissue are having certain changes, and we have to evaluate each of those layers in order to build the right rejuvenation plan according to the problems and where they exist. What about collagen? Collagen loss. Collagen and elastin are the major proteins in our dermis. 90% of the dry weight of our dermis is composed of the collagen. 40% of the dry weight of our subcutaneous tissue also is made of collagen. And the fact is, after the age of 20, we start to lose 1 to 2% of the collagen per year. And this doubles with photoaging. So this explains why our skin in the light exposed areas is having less quality than the hidden areas of the skin. Because in the exposed area to the light, not to the sun only, to the light, is having double the collagen loss. So this is how the skin is looking, where we have hyperkeratosis, less living cells, flat dermoepidermal junction. This is the epidermis. And at the level of the dermis, in the upper dermis, we have lost collagen. And this is what we call elastosis. So when we need to do something, we need to do something at this level in order to stimulate collagen synthesis. And we need to do something here in order to remove the hyperkeratosis and stimulate more living cells. This is what basically we need to do. And this is a 50 years old skin. And this is a boy who is teething his grandmother because he has much better skin than her. She has severe elastosis, as you can see. So he's teething her that he has a better skin than her. And this is my son when he was 2 years old. And also he's teething me that he has better skin than me. So what if we don't do anything about collagen loss? Simply we age. And not only women age, even men age. So that no one is intimidated here. And this,
Dr. Ashraf, we have a microphone here. If any doctor would like to ask, we can pass the microphone to you.
so what happened here was what we expect 10 or 15 years ago. Today, this is not acceptable anymore because we have a lot of tools, because we have social media, and there are so many bloggers who are looking perfect. And the problem is that we have patients who have no problem, but they come because they are seeing the blogger with flawless skin, with certain filters, with certain lights, and in many cases, what they are asking for is unrealistic. In many cases, I tell my patient that your skin without makeup is much better than whoever you want your skin to be like without makeup. So this is another message which we really need to spread, because we see some girls or some patients who are psychologically destroyed because they think that their skin is awful, where they have beautiful skin, but they are comparing themselves with someone who's having a filter or certain lights or certain makeup and so on. So they have to be realistic, and this is our role to explain what we can do and what we cannot do. The question is, can we do that? Can we stop or delay the aging? And the answer is yes. Not only that, we can even revert the signs of aging. This is Dr. Patrick Bitter from US, and this is when he was 43 years old, and this is when he's 55 years old. If I remove all the text here and I tell you which one is younger, you are going to tell me this one. And if I ask how many years younger he's looking, he will tell me 10 years younger, right? Although here he is 11 years older, but he is looking 10 years younger. So we did not only stop the aging, we reverted the signs of aging. And this happened over 11 years through 33 treatments. Is this too much? Over 11 years? Every year, 3 sessions. Of whatever he did, we are going to discuss what to do. But this is something which is doable. My patients whom I'm following up for the past 10 years are the same. Today, they look 10 years younger than 10 years ago. So actually, we gained 20 years. 10 years, they didn't show signs of aging. And today, they look 10 years younger than before. So this is something which is really, if planned well, it is doable. And it is reproducible. This is another patient when she was 38 years old. This is her skin. And when she's 49, 11 years. But she looks much better and her skin is looking much better. The dentists are having a subspecialty called dental hygienist. So this is a very popular job and specialty in the West. In Canada, this is very, very important. And I think we also have to make sure that we turn into collagen induction specialists. We have to do that in our practice. We have to make sure that procedures we are doing are going to replace the lost collagen, are going to induce collagen. And this is, from my point of view, much more important than the quick fix, which we are doing a lot in our clinics. Please try to do something to improve the epidermis and to replace the lost collagen, which started to be lost at the age of 20. So we need to do something at the level of the dermis to change that dermis into that one. This is an 18 years old skin where we can see healthy collagen. Here we have the elastosis. So we need to do something to stimulate the collagen and regain the collagen in the skin. There are so many ways to do that. You have to pick what you have in the clinic and what you have experience with, but this is a very important thing to be added. So the concept of 3D rejuvenation is really very important, where we need to improve the epidermis, we need to induce collagen induction therapy or stimulate the collagen, and if there is skin laxity, we need to tighten the skin as well. So this is something which is easy to evaluate. If the patient is having skin laxity, then definitely we need to have tightening. Sometimes it's not that clear. For example, if you have someone who's having acne scars and they are maybe in the late 30s or 35 or whatever, and they don't show real skin laxity manifestations. But at that time, what you need to do is just to stretch the skin a little bit. The skin, not the muscles. Stretch the skin. If you feel that the acne scar appearance improved, then it means that if you do something for tightening, the acne scars will improve. If you stretch the skin and there is no change on how the acne scars look, then you don't need to do tightening. Don't waste the time and the money of the patient for something where they are not going to see result of. So is the tightening required or no? This is something we have to judge, but for sure, every single patient you are going to see in your clinic will need to improve the epidermis and to reduce the collagen. Tightening is plus or minus. So for each of those, we have different options. You are not obliged to use certain technology. It depends on what you have in your facility and what experience you have, and then you have to pick. So for the epidermis, if someone doesn't have the budget, if someone doesn't want technologies, if someone doesn't want sessions, then we can prescribe retinoids, topical retinol serums or Retin A or whatever, but this has to be used for 6 months and it has to be used gradually so that we don't have the irritation and the peeling which the patient hates. We can do chemical peeling, but chemical peelings in dark skin needs good preparation before, needs good skincare after, so that we don't have hyperpigmentation. So you have to be aware of that. Microdermabrasion with the different types of microdermabrasion, starting with the crystal peeling, and then the diamond peel, and then the hydrofacial, and then the oxygeneo, and all those things are microdermabrasion, and they are very good technologies. I really like them. I always have to have one of those devices because they are not only improving the structure of the epidermis, but also they are improving the lymphatic drainage and the microcirculation, and they are injecting vitamins into the skin without needles. So this is something which I really like. And the beauty about that is that we do a course of 4 sessions, a session every 7 to 10 days. And then there is maintenance of a session every 3 months. Because as I mentioned before, if the aging is a dynamic process, rejuvenation also has to be dynamic. And patients love that they feel that they are doing things all the time. I tell my patients that you need those 4 sessions in the beginning and then a session every 3 months. Many of them are coming to tell me, can I do a session every month? So I tell her you don't need, because scientifically speaking, what you are going to get as a result of doing a session every 3 months is exactly the same as if you do it every month. So it's a matter of money, and I don't want you to waste your money. So there's no harm, but it's not going to be that useful. So they go for every 3 months, but then if they have a wedding or a party, they come to have a session, and then they come in their schedule. So that's why I prefer this concept, the microdermabrasion and the similar technology, than anything else. Of course, laser peel is an option. However, again, it might be associated with some side effects. So you have to know how to care of the skin afterwards so that we don't have hyperpigmentation. So those are the different options for improving the epidermis. And from my point of view, this is a must for everything you see, whether the patients are coming for Botox or fillers, because if you are improving the epidermis, even for someone who wants Botox or filler, then the skin is well hydrated and the elasticity is better. When you improve the lymphatic drainage, then the inflammatory reaction after the fillers is going to be much less, and the durability of those injectables is going to be much better because we are injecting in much healthier skin. So that's why this is a must. What about the dermis and collagen induction therapy? What are the options we have? We have the skin needling, we have the microneedling radiofrequency, we have lasers with different types, whether it is the fractional lasers or the non-ablative lasers, and then we have also the PRP. All those are techniques in order to stimulate collagen synthesis. What about tightening? Again, we have different technologies like radiofrequency, the infrared light and lasers, the HIFO, the threads and surgery. All those are improving the skin laxity. As I said, you are not obliged to use certain technology, but please make sure that if the skin is having laxity, then you do tightening, and you need collagen stimulation, and you need to improve the epidermis. The most common mistake I have seen here is that a patient with acne scars comes to tell me that I went to 4 clinics before I come to you, and I'm not satisfied with what I got. What did you do? Then he tells me, or she tells me, I went to a clinic and then I did skin needling. And then I went to another clinic and I did microneedling frequency. And then I went to the 3rd clinic and they did fractional laser for me. And then the 4th clinic, they did PRP. What is the mistake? Everything is going to stimulate the collagen. What about the other layers of the skin? So this is the mistake. It's okay to combine different technologies here, but we have to understand that this is focusing on the dermis only. Did we do anything to improve the epidermis? No. Did we do anything to improve the skin laxity? If there is skin laxity? No. So the patient will not be satisfied. That's why it's really very important to build a comprehensive plan so that you are improving all the pathology in the skin. You have a question?
But also they will quit too early and they'll switch to something else. They're not consistent about treatment.
This is actually our mistake. If we did not explain to the patient from the beginning, in the first visit, what to expect and how the plan is going to be executed, then they have high expectations. Just before you come, we were talking about this point that patient education is really very important. Why? And this is something I always say. If you explain to the patient what will happen before it happens, it's called patient education, and it is highly appreciated. If you explain to the patient what happened after it happens, it's called apology, and you have to compensate. So if you tell the patient that what we are going to do is going to be slowly improving the structure of the skin and the function of the skin, and what happened over years cannot be fixed between a day and night, then they will know that they have to be, patient. And documentation is very important, because sometimes the improvement is going to happen slowly and gradually. And what happens slowly and gradually, it is easily to be missed. So it's very important to have the before photo. And then when she comes after 3 months to tell you I did not improve, show her the photos.
The problem is when they come from other clinics, they keep jumping. You know, when you said they jump from one clinic to another, this clinic did that, this, that's where the problem comes from.
Now
By the
it is-
time they get to you.
Yeah, but then it is your chance to explain to her why she didn't get it. Sometimes when I get those patients, I tell them what? I tell them what you did is great. Wait for 3 or 4 months, you are going to see results. Did I lose that patient? No. Or I direct her to something to complete what she did. If she did all those, but she did nothing here and nothing here, and this is indicated, then I explain to her, this is going to work on the dermis, it's going to stimulate collagen. And since you did the last session for 6 months, we're going to continue to improve. But we still need to improve the epidermis, and we need also to tighten the skin. And then I tell her what we need to do and why we need to do that, and what she should expect. So again, spending enough time with the patient to let her understand the concept is crucial. And when they do understand the concept, all of them are going to be happy, because this is science. Yes?
I think the other thing I do, which probably would be
Can I give you the mic? Need the mic because I need everyone to hear. It's not working.
Oh, I was loud. Okay. In response to your patient, what I do is I always ask patients, look, this is going to cost, you need about 6 treatments, it's going to cost this much. So obviously people do get quite afraid, oh my God, so much money. Then I say, have a think about it. We're either going to do 6 or 0. I don't even start first session. And 99% of the time people do book in. They have a shock initially about the cost, but they book in for all 6. So the good thing is, after 1 or 2, some people don't see a result. By 3rd and 4th, they see the result. So not only do you get a good reputation, because no one will have 1 or 2 treatments say, oh, that was rubbish. They stick by the 6. And by the 6, they get the results, for example, and then they'll be your patient for life. So I find that really helps.
That's why this is not working. Maybe that's why in many cases what we do is, in order to attract patients for the packages, is to have a price for single session, and then another price for the package, so that they are more attracted to go for the package. Because as we hear now, if someone is definitely having the package, they will see results. Of course, provided that we are doing the right package with the right elements in order to improve all the elements of the skin. So I think this is a technology which we need to adopt, we need to understand, and we need to relay the message to the patients. And I know what happens in the market might let the patient be skeptical, because they feel, I'm coming for the acne scars, and now you want me to do microdermabrasion and microneedling radiofrequency and radiofrequency, so you just after my money. We explain that in a scientific manner, and then it's up to the patient. But at least we explain what they need to do. If they didn't get the optimum result, then you document that, you explain that to the patient declined. So at least you did your part, and it's up to the patient if they don't want to do that plan. So what role does the RF play in producing new collagen and elastin? And this was answered by this study about bipolar fractional radiofrequency treatment, which induced neoestrogenesis and neocollagenesis. And in this study, they looked for the genes or the markers involved in dermal remodeling, and they focused on those markers. But I would like to focus on those: the fibrin, tropoelastin, procollagen 1, and procollagen 3, and those are the values in the mean control specimens. And then immediately after, we can see slight increase from here to there. However, in 28 days, we can see a significant jump and increase. Actually, this is very impressive because this shows that the effect in the skin is not temporary. It's not edema and erythema, which is going to go away in few hours or few weeks. This is something which is going to stay in the skin for a long time. So the technology based on the radio frequency can improve the wrinkles, lax skin, cellulite, which I have some reservation on that because we need to combine many technologies in order to achieve good result here. And this is caused mainly by loss of collagen function. Heating the dermis up to 52 to 55 degrees Celsius was found to trigger fibroblast proliferation and synthesis of new collagen fibers, where collagen remodeling is going to happen. In general, any technology which is stimulating the collagen is working through stimulating a mild inflammatory reaction, where fibroblasts are going to migrate into the area we work on, and fibroblasts are going to synthesize new collagen. And again, this is a process which is going to happen over 3 weeks. In 3 weeks, there will be new collagen deposited into the skin. But what type of collagen? This is collagen type 3, which is immature collagen and it's not functional. So we need to give time so that the collagen matures and turn into collagen type 1. And this is a process which takes about 6 months to happen. And that's why patients need to know that the effect is going to happen slowly and gradually. When we measure the temperature of the skin or the skin surface, when we reach to 40 to 42 degrees, this means that deep in the dermis and subcutaneous tissue, we are about 52 and 55 degrees Celsius. This is very important information because I really like the microneedling frequency and the radio frequency in the indicated cases. I don't like the HIFO at all. Why? Because with the HIFO, we reach to a temperature of, anyone knows what's the temperature of the HIFO? 73. 73. With 73, we get coagulation. Coagulation is going to end up by fibrosis. If you have a plastic surgeon friend, ask them what they see when they do facelifting in a patient who had several sessions of HIFO. They will tell you the fibrosis they see. Unbelievable. But with 55 degrees, we don't get that coagulation and we don't get that fibrosis. And that's why this is a much better technology and safer technology than the HIFO. With the laser and IPL, they cannot penetrate deep enough and they are not very safe on dark skin. And that's why with the radio frequency and radio frequency microneedling, it is independent of skin color. We can treat any skin color without any reservations. Also, the depth of heating here is very much influenced by the geometry of the electrodes and the energy power. So with a device like the Endymed, we have different hand pieces where we can choose or pick whatever is suitable to the area we need to treat. There are some hand pieces where we can go up to 26 millimeters. Others are more superficial, which can work around the eye safely without any problems. And the intensive, we can go up to 3.5. And now they updated the machine to be used even up to 5 millimeters. From my point of view, this is not a very important thing because at the end, there is certain depth we need. We don't really need to go beyond that. Otherwise, it's not going to be very useful. Maybe the 5 millimeter is going to be good for treating hyperhidrosis in the axilla. So it might be needed, but I don't think it's significant. In most of my cases, I never go even to 3.5, maybe only in areas of fibrosis or post-burn scars or something like that. There are several hand pieces where you can pick according to what you want. A small for very delicate areas and fine lines and wrinkles. The eye fine for around the eye. The shaper for the body. The intensive, this is the microneedling frequency. And then we have large RF hand pieces. And this is the FSR for the fractional skin resurfacing. I don't use it a lot because it is sometimes associated with hyperpigmentation if you use it on dark skin types. And I can improve the epidermis with the technologies I mentioned before. And if required, then I use the non-ablative rejuvenation with NDX, so I don't use this a lot. So those, again, the skin layers, epidermis, where we need to achieve epidermal barrier repair. Epidermis, we need collagen induction therapy. And for the hypodermis, the subcutaneous tissue, we need to achieve contouring and tightening. Regarding the RF technology, and this is something which is important to understand the difference, we have the monopolar. Does anyone know an example for the monopolar radio frequency? The mesh. The mesh was the most popular. We know that it is effective in most of the cases. However, it was associated with severe pain to the extent that some people could not continue the session, and it was a problem for the clinic because once you open the transducer, you pay for it. So if the patient cannot tolerate the pain, who is going to pay? It was a big problem. And then we have the bipolar, the multipolar, and then the 3D of the Endymed. So the monopolar, there is one RF generator, controls one electrode. The penetration is deeper than the bipolar, so it's very deep. And there is flow of energy through the body. Actually, this is very important. I would like to highlight this. If you open the manual of any RF device, including the Endymed, you're going to read that one of the contraindication is pacemakers, right? Actually, this is because of the monopolar technology. Because with the monopolar, you put the handpiece here, and then there is the electrode which is put below the thigh of the patient at the back of the patient. And the radio frequency is going to go through the whole body. So it will go through the heart, and it can make a problem for the pacemaker. Only the monopolar. With the other types of radio frequency, the electricity is just between the electrodes. So on the skin only. So pacemaker is not an issue for any RF, only the monopolar. We have to understand why. So it is sometimes we have to dig a little bit better, not to take things for granted. Many examples for that. For many years, I was laughing when I read in the laser manual that it is contraindicated in lactation. And I was saying, laser, lactation, what's the relationship? The laser is not going to be secreted in the milk. So it's not an issue. And then I realized that when there is hyperprolactinemia, the response to the laser for hair removal is nil. Very bad. If you have a patient who came and told you, I got 20 sessions of lasers for hair removal, and the hair is exactly the same. The first question we'll ask is, oh, this is the second. No, this is the second. The first question is, where did you do it? Where? Because if they did it with someone who's having Chinese IPL device, of course, even if they did 50 sessions, it's going to be useless. But if they did it with Dr. Sousan, for example, then we know that they are in good hands, and then this is not the issue. Then we start to ask about hormones. But if they tell you, I got 5-6 sessions and the result is weak, then we are going to ask for PCO or hormonal disturbances. But if they tell you 20 sessions and nothing happened, measure the serum prolactin, and you are going to find it high. Hyperprolactinemia is causing severe resistance for hair removal. So that's why in lactation, it is not wise to do hair removal because the result is not going to be good. So we really need to understand whenever there is something for contraindication and so on, why? Do we really need that? Again, the photosensitizers. Laser is contraindicated in patients who are taking photosensitizers. It is not black and white. What are you going to do? Are you going to do resurfacing in an exposed area? Then it can be contraindicated. If you are doing hair removal with diode laser or NDI laser, which are infrared, it is not a problem at all because for the skin, this is heat, it's not light. So we shouldn't take things blind. We have to understand why this is contraindicated and when it is contraindicated. So the pacemaker is not a contraindication for RF except the monopolar RF. So with that, because the energy delivery is associated with high temperature, we need to cool the skin well, and there is uncontrolled energy spreading, so, and it is painful. With the bipolar radio frequency, there are 2 electrodes on the skin, and the depth of penetration is limited to half the distance between the 2 electrodes. So if the distance between the 2 electrodes is 3 centimeters, then it means the RF cannot penetrate more than 1.5 centimeters, half the distance between the 2 electrodes. So it is a little bit limited, and the efficacy is going to be not very good, and of course the pain is low. The multipolar, the tripolar, and quadrupolar, and so on, there is still one RF generator with 3 to 8 electrodes. And again, it's superficial, similar to the bipolar radio frequency. And no cooling is needed. The depth of penetration is limited. The difference here is that when we have circulation of the polarity, then the RF is going to be more continuous. And this is the main advantage here. With the Endymed, we have the 3D technology, where in this case, we have multi-source, where we have 3 positives and 3 negatives. And each positive and negative is going to have an electrical current, which is going to push the next electrical current deeper and then deeper. So we have 6 RF sources controlling the polarity of the RF. This will enable manipulate the RF current, and energy goes deeper, much deeper into the skin. With much lower energy density, you are going to have deeper depth of penetration, and this is going to be very comfortable and safe for the patient. This is a short video, which I think it is going to explain better the difference between the different technologies. Okay, the video doesn't work, so it's okay. Now, there are some safety features which are really very important. One of them is motion sensor. So pulse is emitted only if handpiece is in motion. And this is very important because some of the technologies which are not having this technique can cause burns. And it happened and it was reported. So here, once you stop moving, the RF will stop to be generated. So this is a safety measure. Then tissue contact sensor, where the handpiece is not going to be emitting RF if it is not in full contact with the skin. And again, this is very important because otherwise you are going to burn the skin. And this is another very, very important thing, real-time impedance measurement of fine-tuned treatment parameters according to the skin properties. So if the skin impedance is low, then it is going to generate more RF and vice versa. So it is going to measure the impedance so that it generates enough radio frequency according to the situation. So the thermal effect can help reduce the appearance of wrinkles and laxity and improve contours on both the face and the body. And this was a study about circumferential reduction using the Endymed Pro radio frequency system, a controlled clinical study with 12 months follow-up. And they concluded that the system used in this study is safe and effective for non-invasive long-term circumference reduction. Of course, when we talk about circumference reduction, this is something I just wanted to stress. It is not only that machine. It is that machine plus lifestyle change with exercise and diet and so on. If they depend only on machine, even if it's the best machine in the world, in a few months after you finish, they are going to come back to square one. So they have to understand that we are going to do our part, but they have to do their part. Otherwise, the problem is going to come back again the same way. So it is really very important, again, to discuss the patient expectations and what they need to do along with what we are doing in the clinics. This is a result of the RF, and we can see the jawline improvement. I don't know if the photo is clear or no, but we can see better jaw line definition. And this is the treated side versus the untreated side. Someone might say that this is temporary edema, but this is a treatment which the photo is 3 weeks after the treatment. So it is not just edema which goes away. Actually, let me just here stress on something. When we get skin tightening with any technology, including the RF, there are few things to expect. Number one, we are going to get the immediate tightening. And the immediate tightening is of two parts. Part which is due to the edema, which is going to subside in a few days. But the other part is the collagen shrinkage. It's just like if you have a wool, whatever, plover, and you put it in warm water, what will happen? It's going to shrink. The same happened to the collagen fibers. It's going to shrink with the heat. And this is a constant or long-term effect. And then there will be collagen stimulation, which is going to happen in 3 weeks, and then collagen maturation, which is going to happen in a few months. So we have to tell the patient that the effect you are seeing is going to decrease a little bit in a few days because of the edema subside, but partially it's going to stay. And this is a case of cellulite after 6 sessions. I think there is good improvement, but this was also a combination treatment with something like the LPG to stimulate the collagen synthesis and improve the connective tissue. Sorry? So the benefits of non-invasive RF is that it is clinically effective. It's 100% of your client will benefit. Of course, with proper patient selection. It can be done simply, safely, and cost effectively. There is no pair treatment cost. There is no consumables here, and there is no downtime. So those are advantages. I believe non-invasive RF should be part of comprehensive aesthetic skin health program. And now we go to my favorite technology, which is the RF microneedling, and this is the latest advancement in the delivery of RF energy. This technology actually is having 2 parts, the needling and the fractional RF. If we talk about the needling, it started with the derma roller, which is a small disposable device which is rolled over the skin in several directions to induce microchannels and microinjure to the skin. And we had a lot of reports, and I think I asked you before we start about your experience, and everyone loves this technology, although it's not heavily marketed because manufacturers of this technology are not having the budget of marketing like many other companies and technologies in the market. But really, we can have very nice results. And one of the major advantage of this is that it is not carrying any risks of hyperpigmentation in Asian people who are very much prone for hyperpigmentation, because this technology is not involving heat. So when there is no heat, then there is no risk of hyperpigmentation. We can improve the scars and the pores without inducing any hyperpigmentation. And many reports of improving the texture of the skin significantly. And when it is combined with the appropriate transcutaneous application of mesotherapy or PRP or whatever, we can get significant improvement in the skin. The technique is very simple, where we apply a numbing cream and then we roll the derma roller over the skin in several directions. We are going to see this pinpoint bleeding. Of course, on the upper lip, it's a little bit more sensitive, but then once we finish, the skin is going to be erythematous, and in a few hours, the skin is back to normal. So this is a technique which is associated with minimal or no downtime. It is safe on all skin types, and if the skin doesn't have laxity, we don't need heat, so it can work even on dark skin types, as we can see. Is there a good scientific base for this? Yes. This article was published in Nature journal, which is one of the highest impact factor journals, and this was published in 2006, and it was discussing electrical signals which control the wound healing. So what happens is that in our skin, in our tissues and cells, there is a negative electrical potential of -50 to -70 millivolts, and this is in the resting phase without any injuries to the skin. If we get an injury, we know for a fact that when we get an injury, this stimulates skin healing and proliferation of cells, right? But they try to find what is the main reason of this skin proliferation. And they found that this negative electrical potential jumps from -50 up to -100 millivolts. So this increase in the negative electrical potential is the main reason of the skin healing and the proliferation of the cells. Moreover, they found that when we insert steel needles into the skin, the negative electrical potential increased not only to -100, but to -150 millivolts. And this is associated with very strong stimulation of the proliferation and the healing power of the tissue treatment. And that's why microneedling is associated with strong improvement of the proliferation of the cells. Is this the only mechanism of action of the microneedling? No. When we insert multiple needles into the skin, this is also going to stimulate mild inflammatory reaction. Acute inflammatory cells will migrate to the area, including fibroblasts. And fibroblasts will stimulate collagen cells. Are those the only mechanism of action? No. When we insert the needles multiple times into the skin, this is going to stimulate the local blood circulation. So more blood is pumped into this area with more growth factors and nutrients. So the viability of this area is going to increase. So we have those three main mechanisms of action of the needling, and that's why it improves the skin significantly. And I don't think there is anyone here who used the microneedling and didn't see a good result with that. So in summary, the benefits of needling is increase the negative cell potential, which is associated with better proliferation of the tissue, increase the local blood circulation with more nutrients and growth factors, stimulate mild inflammatory reaction, fibroblast, new collagen synthesis. In case of scars and fibrotic tissue, it breaks and fragments the fibrosis. With the acute inflammatory reaction, there will be production of collagenase. Collagenase is an enzyme which is going to decrease the fibrosis. And that's why we can use this technology in treating fibrosis and scars in the skin. And finally, increase the absorption of topical agents. And this was proven in a thesis in Marburg University, where they show that microneedling can enhance the transdermal delivery, where they apply some liposomes on the skin without needling and measured the amount penetrating the skin, and they found that maximum 0.3% can penetrate the stratum corneum. And then they performed microneedling and they applied the same liposomes, and they found there is 200 times more substance can be delivered into the skin. This is something which can be dangerous and can be very beneficial. So it's very important to know what are we applying on the skin after the microneedling, because if it's something allergenic or irritant, the reaction is going to be multifold. If it is something useful, everyone is happy. So this is something to be mentioned. The derma rollers which are being sold at the pharmacies, they are home use derma rollers, and those are having a maximum length of a needle of 0.5 millimeter. 0.5 millimeter is only for transcutaneous delivery. So they are used in order to improve the efficacy of the topically applied skincare products. They don't stimulate the collagen. For collagen stimulation, we need a length of more than 1 millimeter. So those rollers people are using, they think that they can stimulate the collagen with, it doesn't work. So this is something also to be mentioned. So the added benefit is to enhance delivery of topicals like cosmeceuticals, biologicals, PRP, and pharmaceuticals. And those are things we can do because the needling technologies, whether with derma pen or derma roll or whatever, even the microneedling radiofrequency, whatever you apply on the skin afterwards is going to be significantly absorbed. So you can apply the PRP after the session, or sometimes we apply hydroquinone or whatever bleaching in case of melasma, or whatever you want to apply. It is going to be significantly absorbed, but you have to make sure that what you apply is not going to irritate the patient's skin. Now, when we are combining both the needling and the RF, then we have controlled heating of dermis and subcutaneous tissues, enhanced dermal collagen remodeling, immediate change in the collagen structure because of the heat associated with the needle, and this is not going to happen with the needling alone. And then long-term stimulation of their collagenesis starting at 4 to 6 weeks after the treatment, as we mentioned. So this is the difference between non-invasive RF and the RF microneedling. Of course, no one likes the needles. However, we understood now what is the benefits of the needle. One of the critical issues, and many people are a little bit confused about using non-insulated needle and insulated needles. So the insulated needles are having the radiofrequency only at the tip, nothing before. And the non-insulated needles, the RF is generated all through the length of the needle. Manufacturers of those kind of needles, they will tell you, I'm safer, because the epidermis is not exposed to RF, so we don't have any burns, we don't have any hyperpigmentation, and so on. Those guys are telling you I'm more effective, because the whole cross-section of the skin is going to be exposed to radiofrequency. So it is more homogeneous treatment and more even radiofrequency delivery. So this is going to be much better for pores, for rejuvenation, for improving the texture of the skin. What about safety? They will tell you the safety is not an issue even here, because RF is dependent on water content. And epidermis is containing 7 times less water than the dermis. So the RF impact is going to be mainly at the level of the dermis, and the more superficial you go, the less water you have, so the less RF impact is going to happen. And actually, this is my experience. I always have been working with non-insulated needles, and I never had any problems. In dark skin, light skin, as long as the technique is correct, then there is no issues at all. And I really like this in order to have more even effect on the whole surface of the skin. This might be good if we want only to get lifting, because when we do lifting, I mean when we use the insulated, then it can cause the same effect like the HIFU, where with the HIFU with transducer, you are having a point at the level of the transducer. If it is 3 or 4.5 or 1.5, this is where we are going to have the effect. So with the insulated needle, it's the same concept, and you can do that. However, even that I can achieve with the non-insulated, where I'm doing the same with increasing a little bit the energy, and I treat several layers of the skin in order to get the lifting, which I can achieve very nicely. So this is the difference between insulated and non-insulated needles. Now, this is important. It's really very important to work with good quality needles, because if you have bad quality needles, number one, it's going to be more painful, and that's why some devices are much more painful than others. But the more critical thing is this. If you don't have a good quality of a needle, it is going to bend, because the needle is going into the skin several hundred times per session. So if the quality of the needle is not good, then it's going to bend, and when it bends, it works like a hook, which can cause minute fibrosis in the skin. So it's not the cheaper is better. It is really very important to make sure that you are having good quality. The needle is not very thick, and it has sharp edge. And because of that also, I discourage anyone to use the same tip again for the same patient. Number one, you will never be able to sterilize well, and it touches the blood of the patient. Number two, the wear and tear. After one session, even if the quality of the needle is good, it is going to have this impact. So I think the patient is paying for it, so let us not, I never use it more than once, even for the same patient. This is the impact of the microneedling frequency on the tissue. And I think we all agree that this is the same impact of the non-ablative fractional lasers. The same impact. So I do strongly believe that anything the non-ablative fractional laser can do, this technology is able to do with the same efficacy, but with much less price. So this is the patient immediately after the session. You can see the redness, and it is very easy to spot where we treated and where we skipped. So we just go back and cover the areas which were not treated. Very easy, very simple, and most of the patients, if not all the patients, in 24 hours, everything is back to normal. Usually in my practice, in a couple of hours, it is going to be back to normal. So the people who are having the same device, how much it takes for the skin to be normal? Hours? The maximum, 24 hours. Did you see anyone who's having downtime more than 24 hours? No. This is my experience as well. And this is the histology where we can see immediately we can have the impact, and this is the thermal effect, which is going to have the inflammatory reaction to get the fibroblasts. And then this is in 4 days where the epidermis is already healed, and the thermal effect or the inflammatory response is still going on for collagen stimulation. And those are some before and after photos. This is 5 weeks after one session, and we can see improvement in some lines of the skin. This is not the end result, and this is only one session, but we can already see that the skin is becoming a bit smoother. It's not the most impressive photo, but I don't like to put the most impressive photos because it is not reproducible. So let us see some average response. This is the horizontal static lines and wrinkles, and we can see the improvement. Periocular, we can work very safely around the eye. It's not like laser where we have to be a little bit away from the eye, and we can improve this area very nicely. Stretch marks, very nice improvement, but this is not monotherapy. This is microneedling radiofrequency plus PRP, and about 4 sessions. And it's very important to tell the patient that we cannot get 100% improvement, 40 to 60%. Always under promise and over deliver. Acne scars, one of the very nice and beautiful results, but again, not as a monotherapy. For acne scars, we need to improve the epidermis, we need to stimulate the collagen, and we need to tighten the skin. If I stretch the skin and the acne scars improve, then tightening is very important. If I stretch the skin and there is no improvement, no change in the acne scars, then there is no need to do the tightening. But for erythematous acne scars, either the pulse laser or this, and with this, we improve even the active acne. Another patient, and we can see also the improvement in the acne scars. 5 treatments, I think significant improvement. And another case of stretch marks, even better. Acne scars, 3 treatments, 1 month apart. Active acne and acne scars. And this is for tightening. This is a combination of intensive treatment, 1 month after 3 intensive treatment, but also the RF was used for laxity. And this is an article which I published in 2013 about treatment of acne and acne scars with the microneedling frequency. It's an open access on Informa Prime. So if you Google it, I think you are going to find it, but it was a little bit old. But science did not change. Active acne is something where we can use it for mild to moderate acne, of course, with the appropriate topical treatment as well. This is not a monotherapy, but we can improve at a certain stage the acne. And the rationale here is that the needles with the heat is going to lead to shrinkage of the sebaceous glands, so less sebum is produced, and also it has a bacteriolethal effect, so we can kill the bacteria. As I said, it's important to improve the epidermis, improve the hyperkeratosis in order to get the best result. And this was another article about skin rejuvenation by microneedling fractional radiofrequency treatment in Asian skin, clinical and histological study, and we can see the collagen build up 4 weeks after the final treatment, and we can see another patient with significant increase in the collagen content of the skin. This is the Pro Collagen 1, the baseline, and we can see the increase 4 weeks after the final treatment, and another patient. So it is really working on the cell level, and this is the elastic fiber. Baseline and 4 weeks after the final treatment, and again we can see the significant increase in the elastic fiber. One of the things which really working well is pores. I didn't see any other technology which can improve the pores as much as the microneedling radiofrequency can do. Of course, the pores is a complex problem. It is not very simple because epidermal barrier dysfunction contributes to the pores. When we have transepidermal water loss and the skin is losing elasticity, then the pores are going to be larger. When the collagen is lost, again, this is going to lead to larger pores, and when there is skin laxity, this will lead to the same issue. So in order to improve the pores, we need to tighten the skin, we need to stimulate the collagen, and we need to improve the epidermis, the 3D rejuvenation. So this is after the treatment, and we can see the significant improvement in the pores. This is an excellent result. Maybe it's not going to happen in every single patient, but this is something we can achieve with the right combination. This is another patient where, again, combination treatment can achieve this beautiful result. And again, this is one of the patients I showed at the beginning as a challenging case, and combination between microdermabrasion, microneedling radiofrequency, and Endymed laser rejuvenation, we were able to achieve this kind of results. And the same here. The same here. And this is very interesting, split face comparative study between fractional microneedling radiofrequency and fractional carbon dioxide. So half of the face was treated with the MRF and the other half was treated with the CO2, fractional CO2. And both the technology were shown to be clinically equivalent. So they both significantly decrease the acne and the acne scars. However, when it comes to downtime with the CO2, as we expect, it was significantly more than the microneedling radiofrequency. They asked the patient to have a second session during the study, but most patients refused because of the downtime associated with the CO2, and they wanted to be treated only with the microneedling radiofrequency. So now, if we have a technology which is as effective as the fractional CO2, but associated with significantly less downtime, I think it wins. So this technology is clinically proven. It is excellent for treating patients of color with textural concerns, scars, wrinkles, and pores. Very effective in acne and acne scars, and this is associated with minimal downtime. Now, this is the last case I'm going to present, and then we are going to end. I know it was too long. Can you apply the numbing cream?
I did. I applied already the numbing cream by 6:30. So it has been 30 minutes. It's a case who has deep wrinkle in the nasolabial combined with the scar in the chin.
Perfect. Okay. So this is the last case I'm going to end up, and I would like to ask a few things about that. When you have a patient like that, do you think the epidermis is involved and we need to do something to improve the epidermis or no?
We need, yeah.
100%. Again, the epidermis has to be corrected in every single patient you see, regardless why the patient is coming. Melasma treatment, acne scars, pores, whatever, anything, because in every single patient you are going to see, the epidermis is impaired. There is photo aging, there is photo damage, and the photo damage doesn't happen only in the sun. The daylight lamps we are staying in all our lives is emitting ultraviolet, and this is causing hyperpigmentation of the skin and causing rapid deterioration of the collagen in the skin. So we need to correct the epidermis in every single patient we see. Botox and fillers, again, if you are working on healthier skin, it's going to be more natural looking and longer staying in the skin. So epidermis is a must for every single patient, including, of course, that patient. When you have a patient like that, would you select a fractional technology or a technology which covers 100% of the surface of the skin? This is always a debate. Do we need fractional, whether microneedling radiofrequency or fractional laser or microneedling, or we need something which covers all the surface? Fractional? Actually, the answer of that question is going to be depending on the extent of the pathology. If you feel that the pathology is localized, then use fractional. But here, the pathology is everywhere. So definitely you need to cover 100% of the surface of the skin. Whether in my hands, I use the Endymed, non-ablative Endymed, because the Endymed is going to stimulate the collagen everywhere. The tightening, if I'm going to do tightening, it is going to cover 100% of the surface of the skin. It is true that we need fractional treatment Again, I mean, in association. But you need to cover 100% of the skin surface because the collagen lost not only here, even here, collagen is lost. Even here, collagen is lost. So you need to stimulate the collagen everywhere, not only in the areas of pathology. So whether we go fractional or full surface, it depends on the extent of the pathology. If someone is having large pores only here, use fractional. If someone is having few acne scars only in localized area, use fractional. But when you have a pathology which is extensive like this, you need to cover 100% of the surface of the skin with whatever technology you choose. Chemical peel, non-ablative laser, radiofrequency, I don't care. But we need to cover here 100% of the surface in association with the fractional technology.
There is frequent question about the subsession, combining the subsession with
Come. Come. Do we need tightening in this case or no?
Stretching the skin.
Exactly. We need to stretch the skin. I stretch the skin, not the muscles. If I stretch the skin gently and the acne scars improve, then the tightening will help. And definitely this is going to be the case in this case, right? If I stretch the skin and the acne scar does not change, then tightening has no place. And this would happen in a younger patient who is having no laxity at all. So definitely this patient will need tightening. Do we need to do subcision in that patient? The answer is yes, because we have few rolling scars. And whenever we have rolling scars, if we do something to stimulate the collagen without subcision, the patient is going to come back in few weeks or few months with deterioration of the acne scar. Why? Because we did something to stimulate the collagen. And when that happens, the thickness of the skin increases. But the rolling scar is have anchoring fiber dragging the bottom of the scar downwards. So the skin around is going to be thicker and more plump, and the bottom is going to stay where it is. So the acne scar is becoming deeper. So definitely we need to do subcision. When would you do that subcision? At what stage? Is it in the beginning or a little bit later? It is an option. However, what I would do is having a plan to improve the epidermis, to stimulate the collagen, and to tighten the skin. And after 1 or 2 sessions, I'm going to see where the areas which are resistant did not improve. And this is where I'm going to do the subcision, so that we don't do it in somewhere where we don't need to do. So I would do it after the second session, after we see what's going on and how they improve. And thank you very much for your attention. I know it has been long and maybe hopefully not boring, but if there are any questions, just can we have just a minute? Whenever we don't have, the question is about the neck. How can we achieve good result with the neck, although we don't have enough subcutaneous fat? And this is very true. Whenever we don't have enough subcutaneous fat, the radiofrequency is not going to be of enough effect in the bulk. Radiofrequency is not going to be of enough efficacy. The microneedling radiofrequency is going to be working because the dermis is containing water. So one of the solutions is to use microneedling RF, and this is going to stimulate the collagen and will help in tightening the skin, because the skin of the neck is the thinnest all over the face and neck. The other thing I do is the non-ablative Endymed rejuvenation, where I can get some tightening when we use long pulse duration. So we can do that because this is independent on the subcutaneous fat. We need 3 sessions, and usually we get very nice results in 3 or 4 months after the last session. It takes time, but it is really working very nicely. No, long pulse Endymed, long pulse, but we are using a short pulse duration, which is 0.3 to 0.6 milliseconds. This is, yeah. There was a question, Dr.
Very much, as usual, priceless switch. About India that you are talking about, the only thing that I wasted, it's using the flash lamp of the long pulsating lamp.
Yes.
So if you're going to go on the full face, you have to use 5,000-6,000 shots.
At
If
least.
you can do 3 full body lasers, so it becomes a bit expensive if you have done half of the this we tried at the beginning, but the flash lamp was going very soon short. That's why I thought that, but it works very well. I didn't want to do lectures in one in hospital because the grammar and it uses a lot of
Thank you, Simi. It's always a pleasure to have you in the audience. Actually, it's true. It's going to consume the flash lamps. However, when we are doing those sessions of non-ablative rejuvenation, the patient is paying. The patients are paying how much for the full body hair removal? It's very cheap, right? But for non-ablative rejuvenation, I personally charge.
Flash lamp.
Yeah, exactly. So I mean, if you compare how much the patient, I charge the patient 200 dinars, which is what 2,400 dirhams. So and the patients are happy, and this is covering the flash lamp. So it depends on if you are able to position this technique well with the patients, everyone is happy. So any other questions or comments? And by the way, there are some devices which are having larger spot size and can do the same, and then the cost is dropped dramatically. Yes.
How many needles is on the cheap one?
25.
So you do 49. Because 49 you get a lot of treatment.
Yes, with the 49, there are a lot of overlap of the radio frequency field, so I don't like that, and I use only the 25. Even I have devices which are having both options, 49 and 25. I don't use more than 25.
Be honest regarding the number of needles is different according to the pathology. If it's stretch marks, it's hard to get good results for few sessions with 25.
So you are using 49.
At least. So it's a must to make every session for the 49. Okay, 25. In between 1 or 2 sessions, 49. You can have last to decrease the pigmentation.
That's fine tuning. So when you have a pathology which is more extensive, like the stretch marks, you can use the 49, but at that time you have to increase the fluence or the energy so that you are not causing hyperpigmentation. But definitely, I mean, if you have the know-how, then you are going to be like an artist. Use whatever parameters with the right, indications.
Exactly, because I tried 25 for 2 sessions, patient is happy, seeing results, but many streaks of collagen bundles inside stretch marks.
Yes.
Especially like the first patient you showed, extensive stretch marks white. Patients see the white streaks, but need to make all.
All, yeah.
So sometimes we
need better coverage. I agree, and that's why the PRP combination is very important as well. Yes.
I already have the RF I've used it for a long time.
Okay.
In your opinion, now, I'd like to get a second one. So I've used the RF, amazing results, but it's about maintenance. So all my patients are on it pretty much constantly. I realize it's not a private, but the patients, I tend to do monthly treatments because they get the big result every month ongoing, and then they skip 1 or 2 months anyway. So I sell a package of maybe 12. They will skip 1 month here and there. So I know even if I say a month, they get the big lift and it's just constant. So it really looks good. But coming to a potential buying a second machine, what are your views on high fluid? Because a lot of patients are asking about this. I've never used high fluid before.
Now, 2 things. Number one, what you are doing might be good, but I think it is over-treatment. Because when you are doing a treatment of that, it's going to stimulate the collagen. In 3 weeks, there will be new collagen, but it is immature and it needs time to mature. So it is just like if you just finished a good meal, you are full, and someone is offering you food, can you eat? The skin is the same. It cannot react. Then what it is reacting for. So actually, this is too much. I mean, it is not harming, only harming the pocket of the patient. It's good for you, but I think it is. I mean, It is just like, as I said, for this microdermal abrasion techniques, I do a package of 4, and then every 3 months. Some people love it and they want to come every month. I tell them, scientifically speaking, it's not indicated. It's not going to harm, but it is not indicated. If someone wants to do it, it's fine. But at least as a physician, sincerely, I told them what is in their favor to the optimum. If they want to do that, it's not going to harm, but it is not really indicated. I don't think it's giving you better result than if you do it every 4 months.
What is this paper published in the Journal of Dermatology regarding that protocol? They said that either to do 4 sessions. Paper published in the American Journal of Dermatology regarding the best protocol for best expectation of the patient. They said that either to do 4 sessions, as you said, every month for 4 months, then wait 2 to 3 months for the full collagen remodeling, maybe 6 or 7 months. Then if you want to hit again, hit afterwards. Or make 6 sessions every 3 weeks. So it will be all finished in 4 months also. Then wait the 2 months, then repeat. This was the best regimen that gave better expectation in for patients.
Now back to the HIFO. As I mentioned before, HIFO is a nice concept that you are giving pulses at the SMAS in order to get some lifting. But the problem is that if you look at the histology, you are going to see that the coagulation is more than 1 millimeter or 2 millimeter around each pulse. And when you are increasing the temperature of the tissue to 73 degrees Celsius, this is causing coagulation, which is going to be converted into fibrosis. And as I mentioned, plastic surgeons who do facelifting on those patients, they will see extensive fibrosis. And I believe that in a few years, we are going to see hundreds of people who have never had acne or acne scars, and they are going to develop lesions like acne scars because when there is fat atrophy with the aging, those scars are going to show. And that's why this is something I don't really like to use in my practice. But for marketing, I mean, many people are asking for it. It is our role to explain to the patients what's good and what's not good for them.
شكرا دكتور أشرف يعني ما شاء الله an awesome presentation as usual. كل مرة ما شاء الله we have a lot of new knowledge. My questions I do have, I'm not sure if other doctors as well they have the same problem. I do come across a lot of patients with rosacea. What can we offer them?
Rosacea is a difficult problem. And according to the stage and according to what we have in the skin, we have to pick the right technology. If we have pustules and papules and so on, this is for medical treatment. If we have erythema and telangiectasia, then it's the pulse dye laser. If something in between, we can use something like the microneedling frequency because.
Sorry, I forgot to make myself clear. If the patient has rosacea, but I mean she wants some aesthetic, like something for example, anti-aging, pores and this stuff, and not for the rosacea stuff.
Yeah. So in this case, the microneedling frequency is a good option because when we get collagen stimulation, then it is going to make the dermis thicker, which is going to compress the vessels, so the erythema is going to subside. But this is a longer term result than the PDL, the pulse dye laser. On the other hand, also you have the NDR, where you can do the non-ablative rejuvenation. In any case, improving the epidermal barrier function is very important because when we do that, then the irritation of the skin decreases because then the epidermal barrier function is much better. So the skin is more closed. When we have epidermal barrier dysfunction, the corneocytes are too much overcrowded. So there will be always some gaps which will allow any products to go into the skin, irritate the skin, because the skin is always irritated. But when we are improving the epidermis, this irritation is going to be much less.
Active rosacea after the activity gets better.
Yes, of course. The active has to be treated with the appropriate. Yeah.
Quick question on your. Quick question on the microneedling. The channels when they're created, how long are they taken for?
90 minutes.
90 minutes.
So the question is about the channels for how long it stays open. 90 minutes. So that's why this is the window, and then it's closed. and that's why it's very safe. There was a comparative study between the microneedling, the derma rollers, and the fractional CO2, and they found that the fractional CO2 was associated with better result for transcutaneous delivery, because with the CO2 we have coagulation. So the channel stays open a little bit longer. So for transcutaneous delivery, the CO2 is better. But there was no comparative study between the microneedling radiofrequency and the fractional CO2 in order to answer that question. But at least here we have some heat, so it might be open a little bit longer than the microneedling alone.
How many shots do you use for a face?
Sorry,
How many shots of the microneedling?
we do about maybe 300.
And does it have any limit, this tip of this
I think it's 1,000, was 1,000. So it is definitely going to cover all what you need. If you want to do the face and stretch marks, it's going to be enough. I never needed to change the tip in a single session, but usually I use the session only once, even if I did only 100 pulses. Good question. So the question is about the interaction between the microneedling radiofrequency and the HA fillers or the bottles. There are many studies and publications which are showing no interaction, but this is not my experience. And we have to differentiate between what we read in the publications and what our real experience is. So I always say that after we inject Botox, I don't want anyone to touch those areas of injection for 2 weeks, because we know that Botox needs 2 weeks in order to exert the full effect. So if I interfere before the 2 weeks, then I can increase the blood circulation in this area. So whatever was not deposited in the nerve endings and having the full effect is going to be washed out. So that's why after the Botox, we have to wait for 2 weeks before we do any other technology. After the fillers, I prefer to wait for 3 weeks because there is an inflammatory process. So I don't want to touch this area for 3 weeks after the filler injection. However, the opposite is not correct. So if you do today a laser or microneedling radiofrequency, once the skin becomes calm after 1 day or 2 days, you can do the fillers or the Botox. So this is the relationship between the two.
But it is now need to tweak regarding the energy-based devices usage with filler, even in combination with same treatments. Like the infrared was the example, using the left protocol with the filler in same session. So they're saying stability as long as you don't exceed 40 to 42 Celsius in the derms, so you are safe and you keep your fillers stable. What's your opinion?
But if you are going to do that, what are you going to do first? The energy-based device or the filler injection?
They say put the filler, then put the energy-based device, especially the infrared as a filler.
If you do that, then the durability of the filler is going to be much shorter, because the heat is definitely going to affect the stability, and the vasodilatation is going to be definitely helping to absorb. Like I don't think this is a good idea. There is no need to do that. I mean, if you are going to do that in the same session, at least do the energy-based device and wait till the erythema subsides and then do your filler. But I prefer actually to do it, not in the same session.
I would like to ask a different question. There are multiple MRF radiofrequency devices. Can you make a comment in this session?
So the question is about the 100 microneedling radiofrequency device in the market and how to differentiate. One of them is here, the 3D technology. It is going to definitely have an impact on the depth of penetration of the RF. There are difference between the two things, the penetration of the needle and then the RF wave. So when the motor is 3 deep technology, then push the radio frequency a little bit deeper, and this is going to be definitely more effective. And that's why one of the important things that when we are using this microneedling radio frequency, we do only one pass. We don't need to do more than one pass with the RF. However, in some cases, I do one pass with the RF and then I switch the RF to 0. And then I do several other passes with the microneedling only to get more collagen stimulation. So this is one thing. The other thing is the method of insertion of the needle into the skin. Some of the devices are having spring, and others are having a motor which is very gently introducing the needle into the skin, and this is associated with definitely much less pain. I think I don't want to name machines, but some of the microneedling radiofrequency devices are severely painful to the extent that some patients cannot tolerate. So with this, as you are going to see, the pain is much more tolerable because it's much more gentle in introducing the needle into the skin. The third thing is the RF wave. As I mentioned, with here we have a wave where when the needle is inserted into the skin, there is no radio frequency. And then when the needle is inside the skin, there is emission of radio frequency, and then the radio frequency stops when the needle is getting out of the needle. And this is minimizing the incidence of burning and crust formation at the surface of the skin. Some other devices are having the radio frequency all through, so the incidence of minute crusts on the skin is much higher. So those are three main differences. What? Sorry?
Why should you only one pass?
Because here, when you are depending on the 3D technology, it goes deeper enough, so you don't need to repeat. Yes. You had a question?
Feeling TCA combined microneedling radiofrequency.
What the
TCA.
TCA? The combination between TCA and microneedling frequency. Actually, I don't like that combination. Some colleagues are using it and using it well for acne scars. If you are going to do that, two things. Number one, you have to prepare the skin well so that you don't have hyperpigmentation. Number two, you have to use much less concentration of TCA than if you are using TCA alone, because the transcutaneous delivery is going to make the absorption much more. So even with low concentration, you might have a reaction which is a little bit more aggressive than you expect. So those are the two things. Both are okay. It depends on what's the problem. But both are okay. Maybe the PRP is going to be a little bit less expensive. You have more amount of the PRP. So it really depends on the case. But I think both of them are perfectly well. Depends again on what you are going to be doing. If it's stretch marks, I inject the stretch marks or the acne scars, and then I apply topically on the whole face. If it is only for large pores or whatever, I mean, you have to judge the clinical situation. If you need to apply only topically or you inject and apply topically, but application, I mean, in most of the cases, you can do both.
When you do the acne scar, do you put a serum? If so, which one do you recommend?
HA or growth factors. Yes, Dr. Nancy,
How many modes that
Sorry?
one or different modes you can choose on the screen?
I don't know if the camera can show here or no, but this device is having one of the best softwares where you can select which area you are going to treat: the forehead, periorbital, cheeks, or neck and hands, or the stretch marks. And each of them, they are having very nice presets, which are really very good.
But you cannot interpret whatever is coming on
No,
the
no, no, you
screen.
can't. No, you can't. I mean, you have the suggested presets, which are having pulse widths 50 or 80 or 110 or 140 or 170 or 200. Those are the different selections. And then the power, which can go from 0 up to 25 watts. And then the depth of the needle, which can increase by 0.1. So those are the parameters which you can select. Of course, the depth of the needle, they are going to give you certain presets, but then you have to judge, because the depth of the needle will be dependent on the thickness of the skin in the area you are treating. Any more questions, or shall we go to the practical part? Practical. لازم السليم على لازم ادخل انا على طول جوه which is okay. ده اوكي بس هتقول الفوت سويتش لو يلا اتفضل So we are going to start the session now, and I choose from all the areas the cheek. With the cheek, we have 2.5 millimeter depth of a needle, and then the preset is 14 watt, and the pulse duration is 110. So this is what the presets are. So when you press the foot switch, the needles are coming out with 2.5 millimeters, as we can see here. And then, as long as I'm pressing the foot switch, the needle is going to come in and out. It is very important to sense the speed while you walk. It's very important to make sure that when we are moving from one spot to another, that the needle is completely withdrawn from the skin. Sometimes it's normal to see some frequent bleeding. We're taking any medications for antibodies.
If you do later only needling or only one pass?
One pass is enough because we don't have here much practice course. So one pass is
lower
fine.
power system, which you cannot use contours here. So you can use all the pieces except the contours. This is this one, yeah.
You use the same technique.
That's why you can put the contour.
Depends when it comes to the under eye, I might decrease it a little bit.
Are you using the same depth under?
No, I have to decrease. So this is 2.5 for the cheek. For the periocular, I think it's we need to go to 1.5. For forehead, it depends on the thickness of the skin. Some people, especially male patients, might have thick skin, so I might go to 1.5. If the skin is delicate, then we go to 1.2.
One question, when the needle goes in, how long should it stay in there to get the best effect of the RF? Or it doesn't matter?
Doesn't matter. Once the needle is withdrawn from the handpiece, then you can.
The RF, no, as in the RF, when it goes down, what should be the period it should stay in? Is it just 1 centimeter?
No.
It's automatically stored.
Yeah, it goes, then it goes back.
When
It's
it goes,
scanning and go.
should it not stay there for 2
You
seconds?
don't,
then?
you don't move. No, no, you don't move till the needle is withdrawn from the skin. Then you move to the next.
I mean, when it goes in, it stays there for 0.2 seconds, 0.3 seconds, then comes back out.
It's automatically actually like scanning, then it's just
In the areas of scars, I can do a couple of passes more. And I'm going to show you that if we decrease the radio frequency to 0, and then we do only needling, it's going to be much less painful.
If you do 1.5, wouldn't
Yes,
work.
this is actually
Sorry?
1.5 instead of 4.5 with no bleeding.
70 milliseconds.
Wouldn't it
It
work?
stays
Yeah, it's going to work, but when you feel that there is large numbers,
Of course,
it is a little bit big, then the 2.5 is going to be less.
And maximum,
Yes.
maximum.
Maximum, I think I use more than 2.5.
At least 1
When you're making the machine, the beginning.
It's just marketing. I mean, if you are living, yeah, if you are living in a city where the maximum speed for cars is 120, and some car manufacturers they come
Maybe
and
I
say, I have a car which goes up to 5 kilometers per hour. It doesn't make a difference.
If you want to be fine, yes.
But if you are living in somewhere there,
in 10 minutes. Let's just finish this, and then we'll go to the nerve down.
now we can see that I skipped some areas. Can you see the tissue impact? So I'm just simply going to cover the areas which I skipped.
maybe because of the numbing grid, it's like one here.
Never works enough.
I don't know what I use, but I usually use a trimix.
The yours is 27%.
Yes. Yeah.
Doctors, there is dinner in the cuisine restaurant at 8 o'clock. So please, yeah.
We're almost done.
You're bragging.
Hmm?
You are bragging after
It take long time. I wanted to give a,
Give you some food, right?
yeah, just to wait 20 minutes.
Now I'm going to do on certain areas here.
Also enjoying everybody.
Are you enjoying?
Very much.
So
It's just an exercise. What they want to change.
so 0. Now with the 0, then this is the device which is being
Microneedling without RF.
I'm seeing something good. So now I'm putting the RF to 0. When I'm doing the RF to 0, then it is only microneedling. So the pain associated is going to be much less. And this is where I'm going to be using the left for only the areas of scarring. The pain now is much less, right? Now that he doesn't feel almost any pain because the main pain is coming from RF. When it is needles, it is much less. And by the way, the needling with this is much less painful than the derma because here we have the gate theory. The pressure sensation carried by the nerve endings is not allowing the nerve endings to carry the pain sensation because we are resting the tip on the skin. So the nerve endings are carrying the pressure sensation.
You don't press more on the scan. Yeah. So sharp, very nice. One of the sharpest needles possible in the market. I think the sharpest. Gold plated. What else?
Actually,
What have to say about it?
yeah,
Yes,
actually,
about
the needle of
because
Endymed,
it's
it's gold plated, but it's a surgical steel.
surgical.
All other needles in the market is stainless steel. So this is very medical needle.
So this is how the skin is going to be looking immediately. You can see the even erythema, very little edema. In a few hours, this is going to subside. So then apply topical even. A couple of hours.
What do you apply immediately after
Tomorrow we are
doctor?
going to be completely fine.
You will tell her she might be.
What do you apply doctor immediately after?
I apply most of the cases hiring just for hydration. That's something which is not irritating the skin.
Like a 14 watts, 110 milliseconds.
Reduce the 2.5 to 2. The power to 12. That's it. That's it. Yeah, you can, but HA serum is much better. It's very important. It makes a big difference if we are stretching the skin. While we put any
The men are not having physical pain, as we know, they are good on the battlefield, but not on.
compared to the pain tolerance of men is much less than the women. This is
Yes, we know.
But he's doing a great job.
Good job.
But he's doing a great job.
Sure, once I have a event, I'll call you.
At least you can give him.
They always say no pain, no gain.
And I already give them 50% discount on the
So like the version I say, make me kill me, but make me good. It is the same. Here I need to, here we will.
If you buy it today in the event, I'll give you 10% discount. No,
It's not expensive for the phone.
it's not expensive, no. But it depends. You know, it's a multi-platform. So it's not only the Microneedle RF, it has 7 hand pieces, which has FSR, tightening, body contouring.
Just the basic one.
The Endymed Pure is 125, the Pro is 175. Only with Microneedle. It's not expensive.
How much in the end?
Usually, you should be able to get what you paid for that machine from maybe maximum 6 months.
So you would have to use the tips.
سعرها 550. Yes, it is consumable for sure, but we give bonus. So you can reach up to 366 with bonus, which is reasonable price.
And how much is the session here?
Between, yes, yes.
In Kuwait, it is 200 between 150 and 200.
That's a good combination. Oh, no, on the right.
This is under the so we stretch the لا 1.2 millimeter depth.
There is no red sign.
What do you mean by
Blue light, red light.
This is going to do also the static lamellar lines. طبعا تشغيل بوتوكس بس ده هيحسن الستاتيك لاينز improve the static lines. Very much true. And sometimes we can lift the eyebrow to that. So yeah, of course. FSR for tightening, but in order to raise the eyebrow, I do this with a little bit more depth, about 2.5 to 3, and then I stretch the eyebrow, and then I do as if I'm stapling.
ممكن يحسب المية
لا مفيش يعني مفيش اي
خليك